Do you clench or grind your teeth? If you've answered no and you're already moving on to the next video, stop. Please listen. Most people who clench and grind their teeth regularly have no idea. They have zero awareness that they're doing it. Yes, it's true. So this video is all about the physical evidence that you can see for yourself that shows that you're clenching and or grinding your teeth at night. So pull out a mirror and take a seat, my friends. For those of you who don't know me, my name is Dr. Priya Mistry, and I'm a general dentist with a practice in Vancouver, Washington. At my practice, we're dedicated to taking care of those with TMJ disorders. Needless to say, the majority of my patients clench and grind their teeth, and the majority of them did not know that they were doing that when they came to see me. Before we get started, take a quick moment to hit that subscribe button. If you subscribe, these videos get pushed out more and more people can find relief from the pain of TMJ disorder. So let's get started. Let's start by defining both clenching and grinding. Clenching is when you press your teeth together with force for extended periods of time when awake or when asleep. Grinding, also called bruxing, is when you rub your teeth against each other with force when awake or when asleep. Grinding activity can be side to side or forward and backward. Habitual clenching and grinding activity is also called parafunctional activity, not to be confused with paranormal activity. Parafunctional activity is activity that's outside the boundaries of the normal activities for the teeth, the joints, and the muscles of the head, neck, and jaw. Normal activity includes chewing, speaking, swallowing, etc. Parafunctional activity is clenching and grinding your teeth. And parafunctional activity, clenching and grinding, puts way too much force on the teeth, the gums, the bone, and the jaw joints. Clenching and grinding activity can be up to 250 pounds of pressure. To put that into perspective, normal chewing is 20 to 40 pounds of pressure. Way less. The enormous forces of clenching and grinding activity, night after night, day after day, will lead to physical evidence of that clenching and grinding activity. And that's what this video is all about, my friends. Many of my TMJ patients come to me in severe pain. And when I ask them, do you clench or do you grind your teeth during the day or at night? Or are you aware of doing that? Most of them deny. And they're doing that because they're not aware of the fact that they're clenching and grinding their teeth. They're not just trying to be difficult. Then, as my patients continue treatment with me, and after I've asked them to monitor for clenching and grinding activity, they start to notice that they clench while stuck in traffic or while focused at work or while lifting weights at the gym. One lady even told me that she found herself grinding her teeth to the beat of the music she was listening to. And that's a real problem because she kind of listens to music all day. So not good. All that clenching and grinding will have negative effects over time on the gums, on the bone, on the teeth, on the jaw joints. Let's talk about these negative effects and the evidence that you'll see of the clenching and grinding now. So I'll list off all the evidence that you'll see one by one, and then I'll circle back around and talk about each one individually and sort of go over how to look for it. So again, have your mirror handy. So evidence of clenching and grinding activity. Number 1, attrition. Number 2, Craze Lines. Number 3, Abfraction. Number 4, bony lumps and bumps. Number 5, scalloped tongue. Number 6, recession. Number 7, fremitus. And number 8, masseter hypertrophy. So let's circle back around to that number 1. The first thing you're going to want to look for is attrition. Attrition is the wearing down of tooth surfaces due to clenching and grinding activity. Take a look at this image. You can see how much the teeth are just worn down. This is not how those teeth looked when they erupted into this person's mouth at the age of 7 or 8. You can see the chips and the fractures on the biting edges of the teeth. Not good. Now take a look at this image. This shows that this individual has actually worn down through the enamel, through the top layer of the tooth, into the next layer called dentin. Dentin is softer than enamel, and because of this, it wears down 7 to 9 times faster. So you can do a lot of damage once you get to the dentin in a much shorter period of time. So now take a look in your mirror, my friends. Go ahead and hold it in front of you, tilt your head down and open your mouth. And look at the top edges of these bottom teeth, the biting edges of these bottom teeth, and see if you can see the next layer of tooth. It's usually a different color. So the outside will be surrounded by enamel And then in the center, you can see the dentin. It's usually a little bit yellower. This is sort of proof, if you see this, that you're clenching or grinding your teeth. Now let's move on to number 2, Craze lines. Craze lines are tiny little vertical fractures in the enamel of your teeth. Not great. Take a look at this image. You can see the craze lines pretty clearly here. Now look at your own teeth in the mirror. Look really closely, and you may even need to shine a light on your teeth to be able to see the craze lines. They're very thin and they can be very hard to see. While you're looking, think about this. Enamel is harder than bone. It is the hardest substance in our body. And if you have multiple craze lines, multiple vertical fractures, thin hairline fractures in a lot of your teeth in the enamel, what can cause that? Normal chewing forces cannot cause that. Only trauma can. If you're punched, if you get in a really bad accident, or if you're clenching or grinding your teeth. So again, these craze lines happen when you're clenching and grinding, when you're overusing your teeth with parafunctional activity. Let's move on to number 3, abfraction. What the heck is abfraction? I always think abfraction is kind of interesting because it's evidence of clenching and grinding in an area, on an area of the tooth where you wouldn't really expect to find it. Abfraction is when enamel shears off of the tooth, right where the tooth meets the gums. Take a look at this image. You can see that the enamel has chipped, sheared, or fractured off in a half moon or a crescent moon shape. So why does the enamel chip here due to clenching and grinding? Well, my friends, the obvious area where the force sort of focuses and is absorbed is the edges of the teeth, right? That's what's actually hitting when we're clenching and grinding. But the second area where the force is absorbed is actually right at the gum line, because that's where the tooth constricts. It gets smaller there. With clenching and grinding activity, the force is also absorbed where the tooth constricts and it torques. And then enamel starts to shear off in that half moon or crescent moon pattern or shape. So now take a look at your teeth. Hold the mirror up and pull your lip out of the way so you can really see the gum line of your teeth. And see, do you have any enamel missing? Do you have little chips in your teeth where you can actually catch your nail on them as you kind of stroke upwards? Do you have tooth-colored fillings that have been placed there because the enamel was missing? If so, that's just more evidence of clenching and grinding activity. Let's move on to number 4, bony lumps and bumps. So these are called bony exostoses, mandibular tori, or a palatal torus. Kind of fun names and a fun little mouthful, but basically it's bony lumps and bumps. Take a look at these images. They kind of show the different ways that these bony lumps and bumps can manifest in our mouths. When we clench and grind our teeth, some of us respond, our bodies respond, by actually building up bone to counter off those enormous forces of clenching and grinding. It's a way of building support and trying to manage all that force that's coming into this whole area. So these bony buttresses form as lumps or bumps. Bony exostoses, which are bumps on the gums, on the cheek side of the teeth. Mandibular tori, which are bumps on the inside, on the floor of your mouth. And then palatal tori, which are bumps on the roof of your mouth. For more information on all of this, watch my YouTube video, Bony Lumps and Bumps. What are they? I've linked it above and below. Let's move on to number 5, a scalloped tongue. What on earth is a scalloped tongue? Well, take a look at this image. It shows a scalloped tongue. You can actually see that the tongue has a scallop pattern on the sides of it. Kind of all the way around really, but mostly on the sides. Now take a look in your mirror. Do you have this? I know I do. So what causes this? Well, this can happen if you have a small mouth and a normal sized tongue, and if you're clenching and grinding your teeth. When you clench or grind, the tongue sort of gets compressed and it gets these indentations, which is where the teeth sort of curve inward as they meet each other. Dr. Jamison Spencer describes a scalloped tongue as a tongue that's trying to escape the mouth. There's not enough room for it, and it kind of gets wedged in between the teeth, especially if you're clenching or grinding your teeth. So if you have enough room in your mouth and you're not clenching and grinding your teeth, you will not have a scalloped tongue. Number 6, let's talk about recession. Recession is when the gums move away from the teeth. Take a look at this image. You can see that the gums have moved away from the teeth and they've actually exposed the root surfaces of the teeth. The root surfaces of our teeth are much more sensitive. So many people with recession have sensitivity to hot or cold or sometimes even air. Just breathing in air can really set off the teeth and cause some discomfort or some pain, usually for a few seconds at a time. There's a myth out there that brushing too hard is what causes recession. And that's just not true. Recession is caused by imbalanced forces. When one tooth is taking way more force than another tooth, or multiple teeth are taking way more force than other teeth, the teeth that are taking the force are gonna have a reaction to that. And that can manifest as recession, or the gums moving away from the teeth. So take a look in your mirror right now, my friends. Pull your lip away, and again, look at the gum line. Do you see that the gums have moved away? Are your root surfaces exposed? Do you have sensitivity to hot or cold or air? If so, that may be evidence that you're clenching or grinding your teeth. Number 7, fremitus. Kind of a weird word, right? So what is that? Fremitus, simply defined, is excess vibration or movement in teeth. It's caused by occlusal trauma, when teeth hit too hard against each other over and over and over again, especially with the clenching and grinding activity. To check for this, you actually don't need your mirror, so you can put it down for a moment. You're going to put your fingernail on any of your front teeth, and then go ahead and bite down. You shouldn't feel that tooth move. If you feel that tooth moving or vibrating, there's a chance that that's fremitus. And if that's the case, that's evidence that that tooth is just taking way too much force. And lastly, let's move on to number 8, masseter hypertrophy. The masseters are these big muscles on the sides of our faces. So you can see them in this image here, or if you take a look at me closely, I'll put my fingers on the sides of my face, and when I bite down hard, when I clench, you'll see that muscle bulge. These are the masseter muscles. Many people who clench and grind their teeth experience excess growth or hypertrophy, excess growth of these muscles. Take a look at this image here. You can see that for this person, the masseters have just grown a lot due to clenching and grinding activity. Some people even experience this growth only on one side, and that leads to asymmetry in the face. So many people reach out to me asking what can be done about that asymmetry. And really, the only solution I know that works 100% of the time is Botox. But Botox is a neurotoxin, and many people don't want to go that route. So for more information on my thoughts on Botox, check out Botox and TMD, which I've linked above and below. So now take a look at yourself in the mirror. Do you have very large masseters, or is one side bigger than the other? That's a pretty good indicator that you're clenching or grinding your teeth. So what can be done about this? If you find all this evidence of clenching and grinding in your teeth, now what? Well, if you're not having pain, if you're not having any TMJ related symptoms, for many people, a simple night guard can suffice. A night guard will not stop you from clenching and grinding, but it'll absorb the force so that it gets beat up instead of your teeth, bones, gum, and jaw joints. If you are having TMJ problems and you noticed all these signs of clenching and grinding, I'd recommend finding a good TMJ dentist in your area to see what your options for treatment are. So that's really it, my friends. Again, I'm Dr. Priya Mistry, and I hope you found this video helpful. If so, please feel free to like, subscribe, and share with your family and friends. Be sure to ask any questions or comments below. I'm a little slower on responding these days, but I'm doing my best. And remember, my friends, you can never have TMI about TMJ. Thank you.